The WHO says contagious afflictions such as HIV/AIDS and tuberculosis are not the ones that pose the greatest global threat to public health. Instead, it says the major threat comes from non-communicable diseases, or NCDs, which are often the result of poor diet and lifestyle choices, environmental influence, or genetics. In many parts of the world, the numbers of NCD cases are soaring, and abuse of tobacco and alcohol have only compounded the problem. The WHO says the billions of dollars being spent year after year on treating chronic illnesses such as cancer, heart disease, and diabetes are pushing millions of people in the developing world below the poverty line. Margaret Chan, WHO's Director General, says greater attention must be paid to the link between these killer diseases and the economic well-being of low and middle-income countries.
For some countries, it is no exaggeration to describe the situation as an impending disaster. I mean a disaster for health, for society, and most of all, for national economies.
Experts say changing demographics are at the root of the NCD problem. In many developing countries, the populations are growing quickly, aging, and also adopting more urban lifestyles. Dr. James Hospitalis, a WHO expert on chronic diseases, says the problem of NCDs is much more widespread than many people realize. He says they are a major problem in big countries like the United States, India, China, and in nations across Latin America and the Mediterranean region. While infectious diseases get most of the attention in Africa, the WHO estimates that chronic diseases will surpass them as the leading cause of death in many African nations by 2020. Dr. Hospitalis notes that in smaller countries such as Trinidad and Tobago or Barbados, the public health costs of treating hypertension and diabetes have climbed to between 5 and 8% of those nations' gross domestic product.
Is not sustainable. It will crush the health services in many countries if this continues. So we cannot wait until we have dealt with HIV and dealt with malaria. No, it's upon us. As a matter of fact, one of the major contributors to tuberculosis going up in several countries is because diabetes is going up and obesity. So there is a link between diabetes and TB.
Dr. Hospitalis says leaders of some middle and low-income countries are beginning to realize that national health policies must be focused more sharply on prevention. He says these leaders understand that even simple diet and lifestyle changes can significantly lower risk factors for stroke, cancer, diabetes, and chronic respiratory diseases such as asthma and bronchitis.
We estimate in WHO that over 30 million lives can be saved in the next 10 years by simple measures, reducing the level of salt by 15 to 20%, reducing the amount of tobacco, and increasing the number of people who are at risk of a heart attack or a stroke to be on simple preventive treatment. Those three measures can save over 30 million lives in the next 10 years.
WHO officials say the UN agency's first global status report on non-communicable diseases, with its country-by-country assessments of the NCD epidemic, aims to educate policymakers, industry and civil society leaders and the general public about the need for a coordinated response to these public health threats. The UN General Assembly will convene its first ever high-level meeting on the prevention and control of non-communicable diseases in New York this September. Vidushi Sinha, VOA News, Washington.